Hello, nice to meet you. It's been a while. Yes, my name is Olufimilayo and I'm a student of NIT. I'm presently doing more learning and more projects to build my portfolio. But I thought it wise to, do a presentation on some of the projects that I've been working on. This project I'm about to do a presentation on is the last project we did with some of my course mates. And here it comes. The title of my project, I'll be sharing my screen. So the title of my project is Exploratory and Descriptive Analysis. The project was gotten from my lecturer. Like I told you, I don't really know the source of the project, but he gave us the data set, and that's what I've been working with. So without wasting much of your time, let's dive in. I'll share my screen. So yes, exploratory, descriptive, and diagnostic analysis on diseases by Olufemilayo Esther. So this is my problem statement. You will agree with me that people have been looking for a way, like medical practitioners have been looking for a way to reduce the spread of diseases, to monitor it also across various age, gender groups, and everything varies differently. Without clear understanding of these patterns, it becomes difficult to allocate resources, right? So the aim of this, my project, is to address these gaps by exploring trends in reported, confirmed, recovered, and fatal cases across multiple diseases within the IDSS2 data sets. So these are the things I did: clean, people process the data, examine, and all. So let's dive in. So my data set contains 500 observations and 15 variables capturing disease outbreak across multiple states. Variables include disease type, age, gender, reported, confirmed, recovered case, death count, vaccination status, location, and all. Okay, so this is the first analysis I did. So in this analysis, I was trying to see a way to check if there's a relationship between the disease and the reported case. Mind you, the disease is a categorical data and the reported case is a numerical data. So therefore, we cannot use it for correlation. Correlation cannot exist. Correlation exists when there is two or more numerical data involved. So here we have one categorical data and one numerical data. So there was no correlation. This is the age distribution of patients, showing that patients that fall into that are prone to these diseases are from the age of 40 to 45. They are more prone to these diseases as the malaria, the typhoid, the tuberculosis, COVID, and cholera. This shows the average age by disease type. This disease type, we have this disease type, the highest disease type, the ones that fall, the highest disease here in this my data set is malaria. So most people fall in this data fall into this malaria category. They fall sick by malaria. So gender analysis of patient, proportion of male is 51 who are prone to the 5 types of diseases. There's a proportion of male that fall into these 5 types of diseases type. They are prone to this disease. For that of female is 49. So this is showing the confirmed and the reported cases. Now, according to this data set, 300 and 3,120 people were reported and the confirmed cases is 26,298. So percentage contribution to the total data set computed. This is what we have. The reported case is about 19.9. Total confirmed case calculated is about 19.8 for the confirmed case. I don't want to bore you with so many of this. So as you can see from this data set, from 2018 to 2022 for tuberculosis, you see that there was an upward trajectory and it came down in 2020. Yes, look at COVID also from 2018 to 2020. It spiked in 2020 because people got involved, like people were involved with each other, so to say that there was contact and so on. Also for other ones, I won't go into it because this is not where I'm dwelling today. So yes, this is where I'll be dwelling today. Yeah, state versus recovery rates. Now, as you can see, according to this, my chart, Kano has the highest recovery rate of about 68.3. For that of Lagos is about 52.3. This shows that Kano has more resources, not only the tools or equipment, probably have more hands there compared to Lagos. So therefore, there should be an allocation to Lagos State. Even Abuja is not doing well, but the fall of Lagos is really, really downcasting. So therefore, it should be looked upon so we can give the correct allocation so other states too can do better. Yeah, in terms of getting allocation and the resources to help cope diseases. Incubation period, malaria is 11.7.07, tuberculosis is 10.60, cholera is about 10.20, COVID is 10.18, and typhoid is about 11.49. So the symptoms and signs are similar. So that's why I did not really look into them. Yeah, we have fever, chills, headache, nausea, fatigue, body pain, and all. So these diseases, they have their incubation days. So if a patient comes in with malaria or tuberculosis, you have to know that these are the days that they have peak levels and they should, get help for them. So some of the diseases, conclusion, some of the diseases are widespread but have high recovery rates. Others present high severity. Geographic difference in recovery rates highlights the healthcare disparities. Now, my recommendation, what do I recommend? I recommend strengthening disease reporting system. As you can see, according to the data set, some of the cases that were confirmed were not reported. That means the reporting system is bad. We need to look into those reporting systems and get the correct instruments, equipment for it. Direct healthcare resources to states with low recovery rates, states like Lagos, according to the data set, should be given resources, healthcare resources to help improve and curb diseases. Increase in vaccination outreach in high-risk area, rural area, for example, they need these vaccination outreaches. Go there and talk to them because they don't have the opportunity to get these resources just like the urban setting. Implement age-specific intervention programs. So the age-specific intervention program should not just be based on those people that are, let's say, the middle age. It should be for everybody, especially the old, because most of them, they're not even aware that that kind of disease is existing. They should be aware that such thing is happening and how to prevent it should be taught to them. They should know that, okay, once they get sick, they should go to an hospital to get tested. Some of them are not even aware. So awareness also should be created. Use historical trend for outbreak and prepare them. Just like what we are doing now. We should have this historical trend so that we'll be able to know that, okay, this disease is what's the next disease that might come and you know how to curb them. Finally, enhance public awareness on early testing and treatments. So if the public is aware that, okay, we have treatment for this type of disease or should come for treatment, definitely, people will come for treatment. But if they are not aware, how will I come when I'm not aware that I'm sick? So awareness should be created on early testing and treatment. I end my presentation here. Thanks for listening. I look forward to your constructive criticism and I want to learn from you. Thanks for watching. I remain Olufunmilayo Esther.